Good afternoon, everyone. I want to thank you for joining the Ridiculously Nice team at AmeriCollect to discuss the surprising changes that came out last week from the big three credit reporting bureaus. My name is Jody Hurd, and I have the privilege of moderating today's presentation. I have with me AmeriCollect's president and resident credit reporting expert, Sean Gretz, who will be taking us through these changes. If you should have any questions throughout the presentation, please feel free to enter them into the chat for this meeting, and I'll compile them at the end for Sean to answer after the meeting's over. A recording of this presentation, as well as handouts, will be available on our website at americollect.com by end of day tomorrow. So without further ado, I'll hand this over to Sean to take us through the changes.
Thank you, Jody. I appreciate the introduction. And yeah, I could have titled this so many different things. I could have titled this surprise changes because I didn't even know about it. Big changes. I could have titled it so many different ways, but I went with big changes coming from the medical debt being listed on the credit file. And they are big, they're important, and you need to know about them. So let's dive in a little bit. First, I gotta say, I'm going to be in support of these changes. The organizations of TransUnion, Equifax, and Experian have decided to make these changes. And as the ridiculously nice collection agencies, I feel we have to support those changes from those partners of ours. So I am going to be of support of these changes. It's the right thing to do from the ridiculously nice standpoint. But let me go back and start in the beginning. I want to tell you where these changes came from, because that's where you need to start. Back in 2014, yes, all the way back in 2014, the Consumer Financial Protection Bureau created a report called the Medical Debt and Collection or Credit Scores. Each one of these slides, I wanted to let you know, has the report on and the link to it, so you can go read it for yourselves. In this report in 2014, they created a committee or a group. It was called the Consumer Credit Panel, and the CCP looked at 5 million de-identified credit records for one of the three major credit reports. So this is where it started. Back in 2014, they started taking a look at some data. 5 million pieces of data, so not a small amount. And they used a period starting in September 2011 as the initial period for this data. They then followed up the data again with a second look at it on September 2013. So that's where this starts. It starts with the CFPB. And they wanted to learn more about what medical debt and credit scores and how they work together. So in that report, let's jump into what one of the questions they came back on this report. They asked the question this. The first one, the CFP examined whether medical and non-medical collections are equally predictive about subsequent respective credit performance on consumers with different types of credits. And the results of what they were looking for, now let me say this, they might have been looking for this result as well. The answer is no. No, they believe that the results suggest that people or consumers with more medical than non-medical collection had observed a delinquency rate that were comparable to those of consumers with credit scores about 10 points higher. Let me show this to you in a chart because I think it's a heck of a lot easier to look at that way. But this is a chart directly from that research they did in 2014. On your screen, you're seeing a chart. That chart shows you two different things. There's one that says any account performance and then also new account performance. What any account performance means is that any account from 2011 and beyond, what that looks like of the performance of delinquency rate, which is this side, what percentage of them are delinquent, to what overall credit score they are. And there's 3 lines on every one of these reports. It's all, mostly, or mostly medical or mostly non-medical. They don't have the definitions of what mostly non-medical is. I want to be clear on that. And then they also have the new account performance. What a new account performance is this. It's in the first 3 months of September 2011, October and November. That's considered a brand new account listed during those months. And they wanted to look to see, okay, if they are the same, are they similar in performance on delinquency rate? Well, for any account performance, the answer is, when you look at this chart, they're almost exactly the same. But when you look at new accounts, and this is where they're pointing to, they're saying that new accounts, there is a difference. They're saying that the delinquency rate for new medical accounts, which is the green one or mostly medical, is different for a credit score than non-medical accounts, meaning there are lower credit scores but less delinquency based upon the credit scores. So this was their answer to number one, right? Going back to that question, what is the performance between medical and non-medical? The CFPB is making the point that mostly medical accounts perform better at a lower delinquency rate than non-medical accounts. Anecdotally, there's many things to take into account here that were not taken into account, but this is the report and research they started with. So let's move on to the second piece of this. The second question they asked the question of, does the CFPB conduct a similar analysis that evaluates whether paid versus unpaid medical collections are equally predictive of a consumer delinquency rate? And again, the answer that the CFPB came up with was no. No, the answer is no, right? So when you look at this, the report in 2014, again, very same chart, very much delinquency rate. What's the percentage of accounts that are delinquent to what's the accounts of the credit scores of individuals? Any account performance versus new account. And again, new account means it was opened in September 2011, October 2011, or November 2011, comparatively to the results of 2013. Going back to the conversation, really looking at new accounts, you can see the difference between the two. You do see a difference here as well. But when you look at mostly paid accounts, meaning if a person pays their medical debt, are they delinquent as a percentage compared to mostly unpaid accounts of medical debt? The answer comes back as, surprisingly, people that pay their medical debt are less delinquent. Good. There's not really much of a surprise there, right? When you really think about it, and in a report, they really talk about this of why that matters. If you pay your medical debt, you're going to be less delinquent. If you pay your medical debt, your score actually, though, when you really look at it, compared to those that mostly unpaid, your score is going to be negatively impacted. That is a problem. Now, I'll say this. To me, there's a huge solution here of let's update the scoring models at the credit bureaus. That's my number one solution. That I would have looked at this in 2014 as the credit bureaus. I would have been TransUnion, Experian, Equifax, and say, hold on a second here. Let's update our models to correct this error from happening. That didn't happen in 2014. So what does that bring us to today? Well, the CFPB, again, switched hands after the election of last year. And during that switch hands, it went back to the conversation of understanding medical debt burdens in the United States. So in February of 2022, this is a brand new release document that the CFPB put out there, again, going on medical debt burdens in the United States. This one had even more research on a lot other items. So let's go through some of the items in the newest research the CFPB released. Number one thing, they had grabbed some big headlines with this because they estimated that $88 billion worth of medical bills are on credit reports. That was the big headline they were hunting for. So that was thrown out there as a big red flag that there's so much medical debt. When you look at it, the CFPB suggests that roughly 43 million people had medical bills on their credit report, or roughly about 13% of the population in the United States. One of the comments that was made by the director of the CFPB, he made the comment of, when it comes to medical bills, Americans are often caught in a doom loop between their medical providers and insurance companies. Our credit reporting system is too often used as a tool to coerce and extort patients into paying medical bills they may not even know. I, for one, immediately took issue with this, and I said to myself, my partners out there in the healthcare industry do not extort. They are reporting what's true and accurate in credit bureaus and or collecting on accounts. And the rare occasion there is a doom loop, it is solved almost immediately by our partners. So there's a little bit in this of saying you got to read with who's making the comments into this. So let's go through what the CFPB commented on this. And first, I'm going to say I'm calling it a threat. I don't know if it's the right term or not, but I'm calling it a threat. The CFPB first said, okay, what we need to do, what are the solutions? And these are the ones that they came up with. First, we need to closely scrutinize the big three credit reporting agencies to ensure that they are not using it as a tool to coerce, extort patients to pay medical bills they may not even owe. That's the first thing they're going to do. So look, when I see this as the big three credit bureau reporting agencies, and I look at myself, if I'm TransUnion, as a president of TransUnion, Equifax, and Experian, I'm like, oh my goodness, this is going to come at us, right? When this is coming from the CFPB. So they had to act here. And that's, I do not, how do I say, look at this and say, why did they react to this? Well, this is the why. The CFPB put out, they were going to act on this. Let's go through the second one, because it gets even the second threat. The second threat, the CFPB says, we're going to work with other governmental agencies to determine whether it is appropriate to include medical debt in their own underwriting and in the role of credit reporting. So they said, we're going to look at all other agencies that have government agencies. And the first one that was announced was that the VA hospital will no longer report to the credit bureau. They worked with the director of CFPB, went with them, we talked about it. You know what's next, most likely coming? The conversation is going to come about Medicare and Medicaid as well. I firmly believe that. That's my opinion. It's not, he didn't say that, but he said he's going to work with other governmental agencies. So it's something to know. And then the third threat that was specifically in that report was this. And finally, we'll be assessing whether it's appropriate for unpaid medical billing data to be included in credit reports altogether. I've highlighted the biggest part of this. So this really, when you sit back and think about it, TransUnion, Experian, Equifax, they knew something was going to happen. They said, let's react before they react for us. So let's go through some of that reports and some of the charts in there, because it's interesting when you look at the data itself. Overall, medical debt collections that are on credit or consumers' credit has decreased by two different statuses. Number one, the first thing is the balance of unpaid dollars has decreased from 2018 from 97 million down to 88 million dollars. So there has been a decrease of medical debt on credit and collection agent or on credit bureaus. The second thing is what is called trade lines. And a trade line is anytime someone reports something to the collection credit bureaus, what are those quantity of items? Well, medical debt went from 143 trade lines all the way down to 111 trade lines in the million. So 111 million trade lines by quarter. So a significant decrease. So it has been decreasing. Let's look at some of the other data. This one's important for later on, because this one's really going to show a little bit more about what they're looking at. They took a look at what are the balance thresholds or the balance amounts of buckets by collection agency or by credit report, right? So reporting to the credit bureau. If you take a look at this, overall, 0 to 100 represents a good portion. So almost exclusively, most medical debts are under $500. It's so small. In the report itself, they talked about that 62% of medical collections were under $490 for trade lines. So know that going into it. That means 62% of what was previously could be reported on the credit bureau is probably going to be wiped off the credit bureau. So they reported on this as something that's extremely important, that there's so many small fragmented accounts in healthcare. As we all know, you have radiologists, you have anesthesiologists, you have emergency room, then you have the facility, and you could have multiple different doctors, right? And individuals that don't pay their medical bill could have all those occasions to go along with it. They pointed to this as a big problem, that there's so many fragmented natures. Let's move on to some of the other things that they put in this report. The CFPB actually put in this report, it talked about that some hospitals and managed care organizations have financial assistance program. I'm sorry, it shouldn't say that. It should say a vast majority of our healthcare system in the United States have financial assistance programs. Is if I were rewriting this, that's how I would say it, because I've helped so many of you guys out there with 501R to make sure you have your financial assistance programs out there. But the CFPB say just some hospitals have it, and most of them do are just way too complex. In this report is what they talked about. It's one of those where this one makes me a little bit angry, because I know so many of you guys have worked so hard on financial assistance and so important to your communities. The other one that they put out there as well, they talked about everything from economics to age groups to race identity to income to the amount of level of a survey that said I don't feel capable to pay the bill. So this is something else that you have to watch as well. Is it's there for you. They're taking a look at everything from age groups, race, all those identifying informations, and they also put it into this report. If you haven't read this report, I would recommend it just to know what's in there. And then finally, one of the other things the CFPB wanted to point out is that states, many different states now, are going and implementing their own regulations in order for medical debt as well. So you got the California has one that's part of it implemented in January 1st of 2022. And second part of it's implementing July 1st of 2022. You have Nevada, where Nevada created a crazy law that said every single patient has to receive a certified letter before you start collecting on it. Certified letter costs somewhere in the range of $5.25 just to mail out. So every patient that goes into collection has to get a $5 letter before you start collecting. You have Washington creating some of their unique laws. You got New Mexico creating some laws, and Maryland. So now we have multiple different states that are creating laws with this as well. It's interesting. I bring this up only in the sense that if you work with a collection agency, you really need to make sure they understand the quantity of laws that are being introduced right now and have a team to understand those laws and to be able to work your accounts to make sure they can collect in those states. I know so many of them that we've been helping out to ensure that we can still continue to collect in this state and comply with the laws that go along with it. So it's important to understand that as well. Many states are coming at you with different laws, and you have to be able to know, do I have patients in those states in order to collect in those states? All right, that's the history. That brings you today. I'm 18 minutes in, and I haven't even touched what happened because of it. So let's talk about that. The Wall Street Journal released an article on March 18th. Anna Matthews was who broke the story. And during that story, she broke that the big three credit bureaus are going to make some significant changes, or what I like to call the self-regulation. They wanted to make changes to the programs that go along with this. And those three changes we're going to go through next. We're going to go through what they are and how they will impact you, and the secondary impacts that I believe. Those are some of my things that go along with this as well. So the first thing that happened from that is TransUnion puts out a PR release notifying of this. I don't think they were ready to put this out. I think they reacted to the Wall Street Journal article because we, as a furnisher or someone that works with credit bureaus, we're not even notified of this. So they put out an immediate press release saying the same things basically that the Wall Street Journal article came through. So let's go through those three major changes. Number one, effective July 1st, 2022, paid medical debt collection accounts will no longer be included in the consumer's credit reports, meaning any patient that makes a payment, it automatically will be removed from their credit report. What we received since the article came out on March 18th was this information saying that as a collection agency, when we furnish, we just need to report that it's paid. They will remove it. Here's the good news for many of our clients. AmeriCollect has been doing this actually for 5 years. It's a little bit different. Each one of our accounts, what we do is actually at the date that a payment is made, we send over the status code 62, and we report really frequently to the credit bureau reporting. So it's less than a week that we mark it as paid. About a month later, we send the removal code because we no longer have the account in our office. After it has been resubmitted back to our clients as being paid, it's removed from the credit reports. So good news, happy consumers everywhere. Their credit scores will go up immediately if they pay their accounts. I actually believe this is what we should have been doing for a long time, is there is a benefit to having accounts, especially medical ones, especially the small balances being paid and removed. So that's why we've been doing it for quite some time. Number one, that's the first thing, all right? So let's go into number two. Number two, they have now increased the timeline for a collection agency to report to the credit bureau. It was 180 days. They have now moved it to 365-day waiting period. And again, down below is the notes of how to define that 365-day waiting period and when it will go into effect from the credit bureaus themselves. This is going to go into effect July 1st of 2022. All accounts that will be reported have to be at least a minimum of 365 days old. So that's the number 2 things that they're going to make an update on. So let's go on to number 3. And this is the one I think is the biggest impact to all of us. The number 1 thing they're going to change is that at least they say there will be a $500 minimum threshold balance for any medical debt to be reported to the collection aid or credit bureaus. At least, I want to be clear on that. They have not defined exactly what that number will be. Again, down here is straight from the credit bureau information that we received. This will not go into effect until at least 3/30 of 2023. There's so many questions with this one yet. As I said before, we have to answer a lot of things with this one. So that's why I believe they give us such a large time frame before it will go into effect, over a year, of course. And if we go back to that chart, remember the chart of showing the balances? Well, that means that 62%, or basically 62%, they say 70%, so I don't know where the numbers are coming in, but 62% of accounts listed at collections or credit bureaus were under $490. That means 62% of the accounts will no longer be at the credit bureau. This is the one where I think is going to have the biggest impact. So I'm sharing you with some data right now of what we've tracked over the years of the ability to recover using working with the credit bureaus as well. I want to be clear, this is something that they're, how do I say, statistically relevant data, and how we use the determination of this may not be as accurate as I would like to be, but I think I need to share it only in the sense that it will impact you if you report to the credit bureau. Meaning that if you have worked on your 501R or your billing and collection policy for hospital systems and have allowed individuals to report to credit bureau, this is the impact I think you can see from it. So what I say that is in 2020 and 2021 and 2019, AmeriCollect has done some studies. We show that there will be a 26% decrease in collections recovery percentage based upon our data of those that report to the credit bureau and those that don't. So a great example, I'm going to throw it out there. Hospital ABC normally recovers 8%. Well, next year, most likely it's going to be at 6%. So you will see a reduction of those amounts. That's only when the $500 change balance goes into place. Everything else, I'm not as worried about. You may see a little bit of reduction as it speeds, as the delay to 365-day comes in as well. So good rule of thumb, just a basic one, that the impact that you, my clients, and or across the country, you might realize is that you might see 2% off that recovery rate that you're seeing by the collection agency on the reports that they provide you. 26% overall, or you can take it and use 26% to take the math of it. Secondary impacts. Number 1, I would say to you all, if you, most of y'all have budgeted amounts for the uncollectible amount on your financials, you need to work with your financial department as of 3/30/2023 to understand that there might be a decrease in the amount that you would collect from it, meaning bumping up those uncollectible amounts could be a potential for it. Secondary impacts that I'm going to talk about as well. Number 2 here, I'm going to say this, is that credit bureaus will become slightly less predictive. What do I mean by that? Well, if 41% of the data that they were previously receiving was because of those small medical accounts, it's going to become slightly less predictive, is my opinion. This is my opinion of this. Every month when a data furnisher, such as collection agency, reports to a credit bureau, what's going to happen is they use that data to update their records to ensure it's the accurate phone number, address, whatever that may be, goes along with it. Well, 41% of accounts are not going to be reported to the credit bureaus, so they're going to have less data. There is a side effect of this. There's a fantastic paper that was done by an individual that really talks about how the credit ecosystem works, meaning that the less predictive credit bureaus are, the less likely they're going to be able to key in on the risks for the overall market. and credit will become more expensive in the future because of it. So that could be a secondary impact of that as well. Again, my opinion, just going through it as well. Third impact, this is one that may be you may see as well, timely filing. One of the things that we see from time to time is that accounts come into our office for whatever reason you were not able to reach the patient, be a phone number or address or a mail return. And because of that, you've reached, and because of that, we collect the insurance and rebuild the insurance company. Well, timely filing is going to be an issue if we can't use the credit bureaus. Sometimes helps us to communicate with patients. That mail return or phone disconnect, sometimes the patient looks at their credit bureau, finds that information, and comes back as well. So there might be more timely filing accounts that come into our office that we're not able to see. So those are the impacts of this. So let's talk about something else I think you should be aware of, is that each one of you that are a not-for-profit hospital has a billing and collection policy. I do believe that you may want to take a look at that on 3/30/2023 or beforehand, most likely not at that time frame. Because I think you need to update that policy to talk about what the extraordinary collection actions are, and especially being that credit bureau reporting is one of them, and update that to read that only a balance is greater than 500 will be reported to the credit bureau, or whatever that amount at least is that the credit bureaus have put out there and said. So be aware of that as well. You want to get to that. I'm going to throw one more thing at you today, and that is, I don't think this problem or items are going away. And I say that only in just next week, Tuesday. You all need to be aware that there is a committee hearing at the Senate Banking, Housing, and Urban Affairs at 10 a.m. Eastern Time on the 29th, next week, Tuesday. I have the link down below for you to register. This is on the economic impacts of growing burden of medical debt. Those that are invited to this are Mrs. Robin King of Ohio, Miss Emily Stewart, an executive director of Community Catalyst, Dr. Benedict, who is a senior fellow of American Enterprise Institutes, a professor, David Hyman, a professor at the Health Law Policy in George Washington University, and then finally the National Consumers Law Attorney Center's Bernetta. And so why I want to bring this to you is not a single healthcare provider is on this list. Not a single one. Not one that can help talk about the benefits that you all do, how you help so many patients in many different ways, from financial assistance and Medicaid eligibility, so many different ways. It needs to be talked about, and we all need to be talking about and sharing this. I'm going to share some of the slides at the American Collectors Associations. I'm not going to go through them. They will be in the handout that you can take a look at it. I know we're running close on time, but the American Collectors Association has sent in some answers, some questions that they had going back to it. The questions that the Senate committee panel asked was, do consumers benefit by not reporting medical debt under $500? And the American Collectors Association has answered back to these. I won't go through it, but there's a lot of comments in here about what happens when these changes take effect. So do consumers benefit with medical debt? It's delayed from 180 to 365. This one, they talked about the timely filing delay and what that will impact. And the final one is, I heard that most of the debt under $500 is actually not actually owed and may be illegitimate or phantom debt. Is that true? This is the question of our senators. They're saying that any balances below $500 is not actually owed. That is what they're asking of these individuals. And the answer to that is, my goodness, no, you guys do an amazing job at helping so many patients. And to be paid for your services is part of the deal that we all sign up for. So you need to be aware of what's happening in the Senate as well. So with that, 12:30, perfect. My name is Sean Gretz. Thank you so much for joining us. Not legal advice. Please talk to your attorney. Jody, do we have any questions?
Sean, just the one thing that we should clarify, there was a little confusion. Our past history has shown that for clients that we do credit report for, we collect 26% more. So the fact that we credit report results in more collections. There's just a little confusion around that topic.
Absolutely.
Everything else is good. You checked all the boxes.
Perfect. Thank you all for joining. I appreciate it. Have yourself a fantastic day.
And again, everyone, the handouts and the recorded webinar will be available on americollect.com by end of day tomorrow. If you have any questions otherwise, please feel free to reach out and contact us at any point. Have a wonderful day and a fantastic weekend.